Yeah, we can't do what we do, Erin, without our sponsors. So I feel like we have to give them a nice shout out, put up that slide, right? Our presenting sponsor is West. They have been with us, and I got to give them their award, Erin, today. So they actually are our 2024 Corporate Partner Award winner for all of their commitment and dedication to health equity and helping moving our community and our integrative therapies across the nation. They have been an incredible partner of ours for well over 5 years. So we just gave that news out. So I had to shout that out a little bit today. They will be with us all year, where we're featuring a lot of that community interaction that they give to Unite for Her. And then our
Absolutely.
supporting sponsors, Daiichi Sankyo, Merck, Lilly, and GSK. Yeah.
Yeah. So nice to have their support. And yeah, so we're really happy to have them as partners.
Yeah, Erin, I always used to open when we would do the wellness orientations, and sometimes when I'm speaking, I always say, we bridge the gap between that medical and the wellness community, between the hospitals and the wellness community. And now I always add in the pharma community, because they have been so instrumental in moving our mission forward and truly putting a stake in the ground that helps us, get that funding that is so needed. I mean, it is the bottom line for Unite for Her. Every patient gets $2,000 worth of therapies, and we can't do what we do without them. And so now I added like the triangle now, it's bridging the gap between the wellness and the medical community. Now we are the wellness, medical, and pharma community, because they've just been so outstanding to us as we went across the nation over the past 3 years now.
Yep, absolutely. So we're happy to have them and very, very thankful, and lots to look forward to in the months ahead, including, like I said, our wrap up for the month of August. So we will be, like I said, a little teaser. We will be finishing the month of August with our Ask the Experts next week. And this is a follow-up to an episode we did, a speaker series on cancer-induced peripheral neuropathy. So we will have our guests back next Thursday at 1 o'clock Eastern time for our Ask the Experts. We'll be streaming live on Facebook, answering your common questions about cancer-induced peripheral neuropathy. So if that is something that is plaguing you, feel free to submit your questions ahead of time. You can go to uniteforher.org/ask and submit those questions. You can also watch us live on Facebook and provide your questions at that time live, and we'll get through just as many as we can. And as usual, we'll be recording that, so you can always hop back to our library and watch that if you're not able to make it. So lots of great topics these next 2 weeks. So be sure to come back and check in.
Yeah. And then use the chat. Tell us where we're calling in from. We are totally across the nation, so we always love that. And tell us where you're joining us from. Cynthia, I saw your question in there. We talked about that September event. It's the Still Rise Farm Wellness Retreat. It's September the 23rd. It's in Percy, Pennsylvania. It is on Dr. Monique Gary's farm. It's incredible, really healing experience. And it is like a half-day event from 11 to 5, lunch and dinner and dancing, and a lot of integrative care, as well as fishing and walking meditations, ecotherapy. Just lovely. So Cynthia, if you can join us, please come. It's free to all of our participants. We are in collaboration with Still Rise Farm, and we're looking forward to, having that event. It's actually the same day as our 5K. So Unite for Her is a busy staff that day. We're going to be running a 5K in the morning and running over, especially Erin and I, to the Still Rise Farm event on September the 23rd. So yeah. What was that? Still in Yardley, but did have a week in Maine. Oh, nice, Janice. Love it. Love it. Love it. Maine is beautiful, right?
Yeah, especially this time of year. Absolutely. Oh,
for sure. For sure. All right, Erin, I think we can get started. What do you think?
I think that's great. Let's hop to it.
You got it. I'm going to put you front and center, and you can do our bios for us.
Wonderful. So we have two amazing experts joining us this evening. Like I said, taking us through a little bit of education and then a little bit of movement. So we have some things to take with us after we wrap this evening. So first, I want to introduce Dr. Erin Helm. She is a licensed physical therapist, researcher, and adjunct faculty member at Widener University here in our local area, providing oncology and lymphedema expertise. She earned a doctoral degree in physical therapy in 2013 and Doctor of Philosophy in Biomechanics and Movement Science from the University of Delaware in 2015. She's experienced in providing direct patient care and developing evidence-based clinical programs in oncology. She continues to educate clinicians, clients, and caregivers regarding the role of rehabilitation in oncology through continuing education and community survivorship education. We're also joined this evening by Dr. Michael Fernandez. He has a particular interest in the treatment of low back pain, vestibular impairments, and management of chronic headaches. He developed an interest in oncological care and went on to receive certification in oncological rehabilitation. He's worked with colleagues to develop the Renew program, a program that provides access to personalized whole person care for survivors in communities that their Kinetic program serves. So please join me as I welcome our amazing experts this evening, Erin and Mike. Thank you so much for both being here this evening. I know you're going to share so much information. We appreciate you.
Thank you for having us. We're really excited.
Yes,
Wonderful.
we're excited to be here. Thank you. Thank you all for being here as well.
Wonderful. And I will say, as they take us through the presentation, feel free to pop any of those questions in the chat as we move through, because this is the time to really pick their brains. So with that, I will turn it over to both of you.
All right, and I will share my screen. There we go. All right, we'll make sure everyone can see it.
That looks great.
Okay. Is it showing up as
You could
like a full screen for you?
not
No,
yet.
it's not in slideshow view. Yep.
Yeah.
Oh, why is it?
You
There
can
we
go
go.
to
That
lessons.
work?
There you go.
Just
Yep.
had to do a second click. There we go. All right. So as Erin so wonderfully introduced, we're going to be talking about balance tonight, and really the balancing act that goes into maintaining your balance and your physical activity throughout treatment and beyond treatment. So the objectives tonight really are to address the association between fall risk and cancer diagnosis. So why do you feel unsteady as you go through your cancer journey? And then what are the risk factors? So how can we help you spot those risk factors? And oftentimes we'll have patients say, "Not that bad, am I? Like, I don't really need to go to physical therapy. I don't really need a cane. I'm not that bad. I'm not going to fall." So we'll talk about some of the risk factors that can lead to falls and can lead to imbalance. And then what you can do. So specifically interventions before, during, and after. So we'll get into the why do I feel so unsteady? So just a little background, according to the US Centers for Disease Control and Prevention, the CDC, 1 in 4 Americans 65 plus will fall each year. Only 50% of those are actually reporting the fall. So the number is probably much higher. And 1 in 5 falls results in a serious injury. And that's for someone without a cancer diagnosis. A cancer diagnosis in and of itself increases that risk. And the prevalence ranges from 33 to 50% or greater as you go through treatment. So it's a high percentage of individuals that will fall during treatment. And 1 in 20 of those falls can result in interruption or cessation of your treatment. So that's why it's really important that if you feel unsteady or you feel like you have a fear of falling, to reach out to someone that can help you and to implement some of these things we'll talk about tonight so that you can continue through your treatment and continue to thrive beyond treatment. So some of the risk factors. So we talk about patient risk factors, and this is for anyone. So a history of falls, falling once actually doubles the risk of falling again. Balance issues, medications, having issues with your walking, so gait, muscle weakness, pain, et cetera, et cetera. All of those are in that patient risk factor list. And then we have environmental risk factors. So thinking about unlocked wheelchairs. So when you go into treatment, if you're in a wheelchair for whatever reason, maybe it's just a long walk and you need to sit down for a period of time, always make sure those wheelchair locks are on. Or if you're a caregiver, make sure the locks are on for the person that you're caring for, because 9 times out of 10, the doctor is going to walk in after you've waited 30 minutes for them, and you're going to jump up to go talk to them, or you're going to get up on the radiation table, and you're going to forget that wheelchair is unlocked and it's going to roll, and that's going to lead to a fall. Same thing with the footrest. So you always want them out away from you when you're sitting down if you can, so that if you have to get up to use the bathroom, the doctor comes in, etc., you're not going to trip over those footrests. Rugs. So oftentimes, and we'll talk about this, we have a shuffled gait. So when you're tired, you don't clear your feet as often, or you might have a walker and you're pushing through on that walker and you catch yourself on that rug. So rugs can make it more easy to fall. And then rushing while you're walking. We'll talk about that specifically with cancer-induced cognitive impairments. And then caregiver hand placement. So oftentimes we have well-meaning loved ones that want to grab onto our arms as we're walking, and they want to help you and they want to hold you, but that actually throws off your center of gravity, your ability to balance yourself. So you think about, normally you have that arm swing when you're walking. If someone's holding onto one arm, if you trip yourself, you're not going to be able to catch yourself. So always hold on to them rather than them holding on to you. So as I said, that list on the left is a general list of all the risk factors that they've laid out. So Sherrington in 2018 was a researcher that looked at all the risk factors. And then they looked at risk factors for someone with a diagnosis of cancer. And they found that all of these risk factors, so having balance issues, being on more than 4 medications, having difficulty with walking, the muscle weakness, pain, orthostatic hypotension. So when you get up really quickly and you feel dizzy, so your blood pressure drops, that's what they're talking about there. Impaired ADLs, so impaired ability to do like your daily activities. So getting dressed might be hard, it might be difficult, or you might have difficulty with balance. Cognitive issues, visual impairments, and incontinence. All of those in that list are specific to cancer. And the severity, the treatments that you go through, all of those things can amplify these deficits and make you more at risk of falling, which is why just having that cancer diagnosis can increase the risk of falling. So we'll talk about some of the specific risk factors, so you have an idea of these things. Specifically, the chemotherapy type and dose, medications, muscle weakness, walking, and then cognition. So the ability to multitask, the memory piece that's coming in there. So for someone that's on chemotherapy, the risk of falling is 2 to 3 times greater than someone that is not on chemotherapy. And the risk increases with the cumulative dose. So how many cycles of treatment you get, how many doses, and then also what neurotoxic drugs are in that cocktail. Neurotoxic meaning they damage the peripheral nerves. So that might be a carboplatin, a cisplatin. So any of those platinum-based drugs, or any of the taxanes, so Taxol, Taxotere, those can also give you chemotherapy-induced peripheral neuropathy. And that impact can last not only during treatment, but you might be feeling off balance and unsteady because these treatments can impact you specifically with chemotherapy-induced peripheral neuropathy for greater than 5 years post-treatment. So these things can linger, and we can address all of these. There's ways that we can address them in physical therapy, and there's the ways that they can be addressed with acupuncture and all of these wonderful things that Unite for Her provides. But you have to speak up and know that these are things that can be addressed later on.
Erin, if I may, just in case there was any questions or confusion about specifically the chemotherapy-induced peripheral neuropathy, which is a mouthful, that often refers to like what we call stocking and gloves, numbness, tingling, decreased sensation. And so in case there's any question on what that specifically is referring to, it's usually a sensory decrease in the hands and feet.
Yeah. So they talk about that stocking glove distribution because it'll start in the fingers and the toes, and it spreads from your fingers up like a glove on both hands and up on your toes to your ankles like socks. And sometimes it can spread past that. And the issue with this chemotherapy-induced peripheral neuropathy is that it can impact sensation. So it might feel numb, it might feel tingly, it might feel painful, but it can also impact motor function. So the same muscle areas or the same sensation areas that are impacted, so your feet and your hands, can also have muscle weakness. And that's where that foot slap or not clearing your feet comes in, or feeling like when you're walking on uneven surfaces, you might be more unsteady because your ankles don't have the strength that they may need to have. And then there's the autonomic component of neuropathy. So autonomic meaning your ability for bowel and bladder function to work properly, your ability for blood pressure to work properly. Those nerves can also be impacted. So that might lead to, when you stand up quickly, you feel like you're dizzy or you feel lightheaded. And then there's vestibular, so the inner ear. So that's feeling of being dizzy because your inner ear is impacted. All of those things can go with neuropathy related to those neurotoxic drugs. Medications. Now we all know when you're on treatment, there's many, many medications that you receive. Just having greater than 4 medications or having a benzodiazepine can result in, so like a Xanax, something like that, can result in more unsteadiness. So psychoactive drugs, so anticonvulsants, antidepressants, those benzodiazepines like Xanax, opioids, and then sedatives, all of those things that might be provided to you can also increase your risk for feeling unsteady. And even some will even say some may cause dizziness, sedation, confusion, hypertension, etc. So anticholinergics are one, so they help with involuntary muscle movements, and antihistamines. So you think about your Zyrtex and your Benadryls and things like that, they can also cause dizziness. So when all of these compound, that can make you also feel unsteady. And then there's muscle weakness. So 40% of individuals going into a cancer diagnosis at diagnosis will have feelings of muscle weakness. Steroid myopathy then can come in when you're provided a steroid with your treatment, or you have to stay on a steroid for a prolonged period of time. That can lead to what we call proximal muscle weakness. So we're talking about your core, so your abdominal muscles, your shoulder muscles, your hip muscles, and your bottom muscles. So all of those muscles help you get up from a chair. They help you get up out of a low seat, off of the toilet, out of bed. So if you're noticing that you're having more difficulty with those and you've been on a steroid for a prolonged time, that's again an indication that we need to intervene and we need to find a way to build up your strength. So yoga is a great opportunity there for core strengthening and things like that. And then also physical therapy can help, exercise programs. Cancer-related fatigue, 90% of individuals have that. And I know you guys have talked about that on multiple occasions with your different speaker series. That can also play a role, because when you're fatigued, you sit more. And when you sit more, your muscles get weaker. And it becomes this vicious cycle where, well, now my muscles are weaker and now I'm more tired and it's harder to get up. The same thing goes with immobilization. So post-surgically, for an individual with ovarian cancer, if they do a surgery, abdominal surgery, and you're not able to move for a period of time, or it hurts to move, that can lead to muscle weakness as well. And then we mentioned the distal weakness, or the muscle weakness in the feet and the hands with the neuropathy. All of those lead into making you feel unsteady when you're walking. So I have listed here things that they know in the research. They've looked at individuals with a cancer diagnosis and they've compared them to someone without a cancer diagnosis. And they said, okay, so these are completely different in how they respond to different movements. So increased postural sway. So when you're standing, if you stand up with your feet together, you have a little bit of sway with your body, right? But when you close your eyes, that sway gets bigger because you take vision away. For someone that is on a neurotoxic drug, so the carboplatins, the cisplatins, the taxanes, that postural sway gets to be more, and you become more visually reliant. So you might see people looking down, they're gazing down at their feet because you don't have that sensation there. Or you might have more sway because the receptors in your muscles aren't kicking in to keep you upright as quickly. So writing reactions or your reaction time might be slower. So you're at the store, someone bumps you, it might take you longer to take a step and catch yourself because of the weakness. And then reduced endurance comes in there. So adriamycin, we know that's one of those drugs that can be difficult for the heart. And heart is a muscle. We can build that up with exercise, but it also gets fatigued. So when you have decreased endurance, again, that goes to that immobility and the inability to get moving, and then the muscles get weaker. And then there's cognition. So all of these factors are in play, right? So 75%. So it used to be, oh, it's a small percentage. Really, it's just a phenomena. Now we know 75% of individuals going through treatment are going to experience some kind of cognitive limitation, whether it's you just feel like dual tasking is difficult, or trying to plan out your day, or trying to remember something or recall words, even just tiny little things in your day. They all can play into your balance. So if you think about when you're walking and talking with someone, generally you slow down your walking, or you might trip up as you go up a curb. So typically your motor performance or your ability to move slows down as you do more higher level cognitive activities. So you're multitasking, you're on the phone, you're trying to manage children, you're doing all these different things, you're at work and you're trying to do things. You're more likely to trip. So they've shown a relationship between your balance, your ability, this cognitive impairment, this cancer related cognitive impairment, and falls. So with increasing reports of inability to recall words, decreased memory, or inability to dual task and to really do all that multitasking, the ability to multitask and move and think goes down, and there's more risk of falls. So I have here this list, not to inundate you, because you all know, you've all lived through this, right? So you know all of the things that come with all of these treatments. But this is just to point out that you feel unsteady because all of these things you've experienced, it's never just one thing. It's not a silo. It's not an isolation. There's going to be multiple treatments that you have, and there's going to be multiple different side effects that you have, and all of them can sneak in together to amplify your balance deficits, amplify your weakness, amplify that risk of falling. So this brings me to spotting those risks. So we know that all of these treatments combined together, they amplify that risk of falling. And falling once doubles the risk of falling again. So I want you to be able to spot the risks and then be able to find an intervention that works for you. So I want to say this because oftentimes I'll have someone come to me and they're like, I didn't fall. I slid off my chair to the floor. I didn't fall. I tripped and I grabbed the wall. It still counts as a fall. It's still a fall. So accidentally landing on the floor, another object, tripping over an object, falling to the ground because you're dizzy or you feel weak. All of these things count as a fall. And if you've fallen once, there's a chance that you can fall again. So we really want you to get the assistance you need. So some common signs that your balance is off. Seeking out assistance, or furniture walking, as we call it. So you say you don't need that 4-letter word, that cane, but when you're walking from room to room, you kind of touch the wall, or you just touch down with your fingers on things. That's giving you input. So that's giving you input you didn't have before to steady yourself, and it's an external input. And what I explain sometimes is that's fine. But if you're constantly reaching for something to keep your balance, and then you go to the store and someone bumps you with their cart, or someone's on their phone and they're not paying attention, they don't look up and they bump you, and you go to reach instead of go to take a step, or your reaction time's slow, your brain is going to have that pattern of reach, don't step, and you're going to go for a can of beans that's not going to hold you up. So we want to make sure that you have strategies in place that will keep you safe. Scuffing feet or drop foot. So sometimes you'll have a loved one say, I can hear you coming. Will you pick up your feet? But it's because of the muscle weakness at the ankles that you'll notice that your foot will kind of slap down at the ground, or you might not be able to clear your foot as well, or you're scuffing your feet. So there's exercises we can do, even just sitting and lifting your toes up and practicing that at night, especially for someone with neuropathy. Practicing 50 toe lifts at night, just bending your ankles and lifting your toes up every night. Start with 20. And if you can get to 20, then you go to 30, 40, 50. And what I tell my patients is that as you get to those higher numbers, make sure you do this at night, because you don't want to fatigue out those muscles in the morning. So if you do it right when you wake up, that's great because you know you're getting it over with. But then you still have your day to carry on all the activities that you typically would, or you might have doctor's appointments to go to, or you might have to take your children somewhere. So you want to make sure that you're doing it at night when you're then going to get to rest afterwards. And even if you don't see a movement in the foot, or you only get to 20 and your feet won't raise anymore, keep thinking about it and keep trying. So if you feel like those muscles are kicking in, even if you don't get an ankle movement, that's enough. Okay. Downward eye gaze. So I mentioned that before. If you're looking down, oftentimes it's because there's sensation issues and you're relying on your vision to keep you steady. So we have 3 systems for our balance. So we have our inner ear, that vestibular system. We have our sensation, and we have our vision that keeps our balance. So when you take vision away, or you're looking to cross a road, you're looking up, talking to someone while you're walking, it makes you feel more unsteady because you're relying on those other 2 systems. Postural changes. So sometimes with that steroid induced myopathy, or you're on steroids for a period of time and it makes the ab muscles or your core weak, you tend to lean over more, you tend to slump over more. And then with walking, it becomes an issue and your center of gravity comes forward. So then you tend to tip forward. So then if you do scuff your feet, you're more likely to tip forward and fall. Decreased gait speed is something that we often will measure in physical therapy to look at how you're walking and your endurance, and do you sway with your walking. And then multiple attempts to stand from a chair. So this is one of the activities that we'll try, is just getting up and down out of a chair and seeing how many times it takes you. But that also indicates that you have muscle weakness that can be leading to that feeling of being unsteady or that increased risk of falling. And then again, that history of falls and dizziness upon standing. So that's something that we won't necessarily address, but we can work with you. So hydration comes in, talking to nurse navigators comes in there, proper nutrition, all of that comes into that piece as well. So one of the resources I have here in this slide, and then we can also add this into the chat or send it out later, is the resource algorithm for fall risk screening, assessment, and intervention. It's by the CDC. So the CDC has a lot of great resources for fall risk, and we'll talk about them. So this is a screening that they want individuals that are in the medical field to ask. So they want them to ask, have you fallen in the past year? Do you feel unsteady when you're walking or standing? And do you worry about falling? If you answer yes to any of those, then we need to think about what interventions do we need. So then we need a formal intervention because we want you to not fall again. So meaning talking with your physician, talking with your care navigator, your nurse navigator about getting into a physical therapy program or doing a program in the community. So the YMCA has Live Strong programs that you can get into as well. They also have a fall risk self-report questionnaire, and it's called the Stay Independent questionnaire. And what it does, I like it because it asks you multiple questions and then it tells you why it matters. So why is it important to your risk of being off balance? So the one that I've hammered home here is I've fallen in the past year. So, and then it says why it matters. People who have fallen once are likely to fall again. Or I steady myself by holding on to furniture. Or I need to push with my hands to stand up. So all of those are in there. And if you answer yes, again, if you get 4 points or more, then you want to be speaking to your physician about what services are available to you so that you can get in for a formal assessment and see what we need to work on. So this is where it challenges you a little bit. So here's some things that we would challenge in the physical therapy clinic. So I don't want to put everyone on the spot, but I know, Erin, you said you guys will engage and make people work a little bit. So one thing we use in therapy a lot as an assessment tool, but also as a strengthening tool, is just sit to stands. So just doing sit to stands works on your quadricep muscle to help you to build strength. And it also works on your posture, your balance, all of those pieces together. So doing a timed sit to stand where we have someone do sitting to standing 5 times in a row without holding on. If you time yourself at home, if you do it and it takes you longer than 12 seconds, that tells us that there's a risk of falling or there's a balance issue. What we can do here is just practice that. And what I want you to think about is each individual is going to have more strength, or some people may have more endurance. So you're just trying to get to even 10 sit to stands, and you could do them in the morning, the afternoon, and at nighttime, and do it with a table in front of you so that you have something to put your fingers on, so that when you stand up, you can do so. So one of the ways, and I apologize, I'm in shorts right now because my house is all packed up and I have no idea where my dress pants are. So I'm just going to practice. But so if you can see me, when you stand up, oftentimes we stand up and our muscles are weak, so we keep our shoulders back. You want to stand up by leaning forward so that your bottom starts to come up first. So you're rocking your shoulders forward and then pushing up. And that's going to engage your glute muscles and your quads at the same time to make it easier. Oftentimes when we go through treatment, we keep our weight in our feet, in the back, in our heels, and it pushes us backward and it makes it so much harder to stand up. And that's where you get into that repeated trying to stand up. So even just practicing that proper movement of holding on with your fingers, fingertip at the table, rocking forward till you feel the back of your bottom start to lift up, and then push up is going to help. You got it. So that works on those muscles, and you'll feel your glutes kick in then before the front muscles, your quadriceps, the ones in the front of your thigh kick in. And that just in and of itself is going to be helpful. And then the other piece to that is when you come back to sitting, I want you to count to 5. So that's going to take less energy from you working on that eccentric control of those muscles than going up, but it's going to work those muscles harder. So you're going to count to 5 as you go down nice and slow, and you're going to feel those muscles working, but it's not going to feel as tiring over the period of time. So even just trying that 10 times will be helpful. And it might not be that you can get to 10. You might start at 3, and then next week you go to 4, the next week you go to 5. The other piece that we'll test in the clinic is single leg stance. So this one's a little bit more dicey, but so standing up and trying to balance on just one foot. I don't know if you guys can see me from there, but just trying to stand with one foot by keeping something near you so that you can touch, and then let go gently and try to balance in that position. The goal would be to get to 10 seconds, just being able to do it for 10 seconds on each foot. And that, when you have neuropathy, can be really difficult. And that's okay, because that's something to work on. So in the picture, they show what we call a Romberg, a sharpened Romberg, and then eyes open and eyes closed. And what that means is you're doing feet together, really tight together, so like this, and then they go semi-tandem, and then they would go one in front of the other foot. So that's a progression. So if you can't stand on one foot by itself, then you're going to try just feet together. And if that feels easy, you're going to slide your feet slightly apart. And if that's easy, you're going to put your feet one in front of the other. And that's another one that's going to work on balance control and your postural reactions. So the reason we hammer home that single leg stance is you think about the amount of times you step over a cat, you step over a dog, you go up a curb, you have to step over a pothole. All of those times you're only on one leg. And if your sensation's off or your muscles are weak, it can make it really hard to balance on that one leg. So we want to build up to that. So even just starting with your feet together, and this one's a great one to practice in the morning. You stand in a corner, you put the chair in front of you, and you just try to balance there. And if that is easy and you don't sway at all, great. Then you're going to go semi-tandem, and you're going to put one foot just slightly in front of the other. And then you're going to go toe to toe. And just try it 4 times for 30 seconds, if you can get there. Renee, please don't fall over. Malfunction. So those would be things that we would start just in the clinic, just working on. And you can do those at home. When that gets easy, start trying to turn your head as you do it. So if you're standing with your feet apart, let me get this back further here. Don't do this on a chair. Can you see me? And then you get to here, and then you can turn your head. That's even better. Because then you're taking vision out of the equation. So now your vision isn't stabilized to help you. So now your sensation and your muscles all have to work harder. And that's what we want. We want to challenge those muscles to work harder to keep you balanced. So those are all things that just starting there, working on the proximal muscle strength and then working on that balance at the ankles and the stability at the feet are two great things just to start with. Some other things you can do, thinking about environmental factors. So I briefly touched on those in that list at the very beginning. So throw rugs and clutter. Throw rugs are a no-no. We don't like them, but we all have them, right? So you want like something non-skid underneath of them or double-sided tape at the corners so that you don't catch or they don't shift on you. That's a big one. Lighting can be an issue. So getting up and going to the bathroom, we want night lights. We want a light so that you can see, because as you go through chemotherapy specifically, sometimes that can change your vision. And they'll often tell you, well, don't go see your doctor until like a year later, because vision changes as you progress through chemotherapy and then even after. Your bathroom setup. So thinking about where things are positioned. Grab bars are really helpful, especially as you go through treatment and the muscles are weak to get up and down, especially in the tub. And then stairways. So again, making them free of clutter, but if you can, add more lights, add something that'll allow for that contrast in the steps so that it's easier and more clear to see. And then those well-meaning friends, tell them to keep their hands off of you and you will hold them if you need to. Oh, let me go back 1 second. Again, there's a check for safety. So the CDC, that same website, when you go there, they'll also have a check for safety, which gives you a home fall prevention checklist. So it goes room by room, and you can actually look at all the things that might make it a higher risk of falling. And you can kind of check them off like, yes, I have this, no, I don't. And it'll help kind of guide you with all the different things that we've talked about. So if you can, you want to add non-slip surfaces in your bathrooms, obviously, so that you're not slipping on any water. Night lights. If you have a bathtub where you have to step over, even just for treatment, getting a shower chair is phenomenal, because then you can sit on that chair. If you're having orthostasis where your blood pressure kind of fluctuates, or you're just feeling dehydrated with treatment and weak, it's wonderful to have that if you don't have a grab bar. Adding grab bars is also wonderful. Railings, if you're feeling really weak, if you can get an extra railing, is beneficial. So having one is great, and people tend to pull themselves up the railing, but having two gives you a lot more ability to stabilize yourself. Non-slip handles, reachers, and then also I have here, so for someone with CIPN, it's really difficult to tie your shoes, right? So you either are numb or it hurts, you're hypersensitive. So I'll often recommend individuals just go on Amazon and get, just type in elastic shoelaces and get something that you can pull once and it lets go and it gives you that tension. So you don't have to worry about one, tying those shoes, but also not tripping on the shoelaces if you don't tie them tight enough, because it's hard to do that task. The other thing is grabbers. So oftentimes just having a grabber, so you know that feeling you lean forward and you feel like you're going to fall, you have to catch yourself. Having something that can pick up that sock on the floor or pick up something that's fallen down in a precarious area can be really helpful as well.
Erin, could you share with the group CPIN?
CIPN? I'm sorry, did I say?
Thank you. CIPN.
Yeah. The chemotherapy-induced peripheral neuropathy. So it's that feeling of numbness and tingling or pain and hypersensitivity in the hands and the feet.
Thank you.
Absolutely. And then so we talked about those environmental factors, but the intrinsic factors. So those the issues that are directly related to your cancer journey. So feeling unsteady, reaching and furniture walking, we've talked about. Pain can make it really difficult to walk. It can make your pattern of walking more off. And so that can increase your balance deficits or make you more at risk for falling. The orthostasis and then vision. So all of these things, the pain, the orthostasis and the vision, are 3 things that you really need to talk to your provider about. So if you're past treatment and you're back to your primary care provider, talk to them about these things, because they can all contribute to balance issues and really your ability to go out and live your life and not have to worry about balance and fall risk. And then you can, while you're in treatment, talk to your nurse navigator or your care navigator. So the first one there I mentioned was that furniture walking, and I'm coming back to this. So the 4-letter word, the cane, that everyone always grimaces at. So I like to put it as it's not something that you necessarily will need forever. So just like crutches, you break your ankle and you need crutches for a period of time to keep you safe, to keep you off of that leg so that you're not injuring yourself more. A cane or a walker can be beneficial when you feel really unsteady. So if you're finding that you do that 5 times sit to stand and you can't do it, it's really difficult and you're doing it and it takes you a minute to get them done and you have to really push through your hands, or you can't stand on one foot at all, or you barely can stand with your feet together, that's telling me that there's something there that we need to work on. But in the meantime, you might also need an assistive device to keep you safe. So it's just a temporary thing that we need until we build up your strength, we build up and address the neuropathy symptoms or the other balance issues, and then we can eliminate it. If you have a cane or walker, you want to make sure it's at the right height. So oftentimes I'll see an individual and their walker may be here, or it may be way down here. You want it so that when your hand falls just nicely at your waist, it sits at the wrist line. So it should sit right at your wrist crease. And that's going to give you the most optimal support, because if it's too high, it's going to push you backwards when you put it down. And if it's too low, you're going to lean forward. So you want to make sure that you're using it properly. And if you have questions about it, if you have an assisted device, I'm happy to answer questions afterwards. That's fine too. When you're using a walker, push it like a shopping cart. So don't push through and down, because if you push through and down, you're going to flip it just like you'd flip your shopping cart. So think about the amount of weight you would push through a shopping cart as you pushed it on your walker. So oftentimes I'll see patients and they're pushing down and their knuckles are white. We don't want that. We want to push gently. And you can also consider if you're having issues with your endurance, you might be on adriamycin and you need a seat. Some are called rollators, have seats and little baskets underneath so that you can put your things in that. So if you're out and about in the community, you have that as a support. And then also a cane is nice, but you want to consider what type of cane you need to use. So cane, you can look at single point canes, which are great because they give you just that touch, that fingertip touch support, just like with furniture walking. A 4-point cane, or you'll see them like at CVS and things like that, they have those 4 points and they're wider. That helps to give you more stability, so you can put a little bit more weight through that. But it also helps because you can let it sit. So if you're out and you're walking and you need to reach for something, or you need both hands to sign a paper or something, it's not going to fall off the counter while you're signing a document. You have more control over it. So now we're to therapy. So what I do. So when we talk about physical therapy, oftentimes we're not just addressing one thing. So with balance, we look at strength, we look at sensation, we look at specifically your balance, that single leg stance, all of those pieces go into it. And we typically will address that by doing a combination of different things: aerobic exercise, strengthening exercises, and balance exercises. And all of those together not only affect your balance, but they also affect other aspects that we talked about before. All those things that feed into balance also can be treated by addressing balance through aerobic exercise, resistance training or strength training, and balance training. So some of the evidence out there is not necessarily from individuals that have a cancer diagnosis, but just individuals in general that have a fall risk. And they've looked at the evidence for physical activity and preventing more falls. And they found that doing balance and functional exercises, so doing those sit to stands specifically, doing the things that are difficult, can lead to a 24% reduction in falls. When you add in resistance exercise and aerobic exercise, there's a 28% reduction. With Tai Chi, you can get a 23% reduction. And then if you do 3 hours of training a week, so maybe 3 times a week, you do an hour, it leads to a 42% reduction in falls. All of this information has then been translated to oncology. And now they're starting to look at research and how this all applies to someone with a cancer diagnosis.
Erin, if
Yeah.
I can interrupt for just one moment.
Yeah.
I think that one thing that if everyone's not aware of is if there's a local YMCA and there is access to, say, the Live Strong program, that would be a great way to get in and maybe try some Tai Chi. A lot of the YMCAs, so I work out of 2 different YMCAs and both of them have multiple Tai Chi classes. So the Live Strong program, people who have participated in that get a free membership for 12 weeks through the Live Strong program, and it gives them an opportunity to participate in Tai Chi. So if there's one near you, that might be a good way for you to explore that.
Absolutely. Thank you, Mike. So the current evidence here, when we translate it to oncology, the National Comprehensive Cancer Network says to prevent falls, you want to do early and preventative use of the durable medical equipment. So talking about those chairs in the shower or grab bars, things like that, reachers. It moved on me. Assistive devices, so those canes and the walkers, and then a home safety evaluation. So asking a local physical therapy or occupational therapist if they can give you an evaluation, or using that CDC checklist and going through that room by room to see if there's any issues that you need to address. And then the American Society of Clinical Oncology, they talk about falls and difficulty. They talk about it as IADL deficits, so instrumental activities of daily living. So housekeeping, cleaning things in the house, going out and grocery shopping. If you're having difficulty with those things, they want you involved in physical therapy and occupational therapy to work on strength and balance, use that assisted device, and then get a really good home exercise program. Talk about fall prevention, and then again, that home safety evaluation. So some questions, if you are going to think about considering going into PT. So first of all, I want to say for physical therapy, so we're located in the Philadelphia region, but if you're anywhere else, the Academy of Oncologic Physical Therapy, you can go on and type your zip code in, and you can look for therapists specific to oncology in your area. If there is not a therapist coming up in your area, look around at the directory, just Google physical therapy in your area and call them, because typically your insurance is going to cover physical therapy services. So the first thing I would ask is my insurance covered? And they can do an insurance check before you ever come through the door, and they can tell you how much out of pocket it might cost you. So you might have a copay or something like that. But then you can start asking these other questions about who works on balance in your department. Can I speak with them? And then we're going to start asking questions to them so that you can get your needs met. So specifically, we want to talk about, are they familiar with your past, your current, and any upcoming treatments? So do they know about platinum-based drugs? Do they know about taxanes, Taxotere, Taxol, and the implications of that on neuropathy? And do they know about steroids that you might take? Ask them how they'll incorporate your treatments into the plan of care. So if you have upcoming treatments, how are they going to tailor their exercises to still achieve what you want to achieve in therapy? Ask them what activities they might plan for you at home. And then, are there any recommended community programs? So like Mike said, the YMCA is a great one. Unite for Her has great programs. There's all different areas. Cancer Support Community has some programs as well. That you can get into these different programs to continue on with your exercises safely. So all of those things, those therapists should be able to answer regardless of where you go.
Aaron, if I could add something to that, I think I mean, this is just my personal opinion. I think that when you're choosing a therapist or a physician or an acupuncturist or a massage therapist, I think that one of the things I look for in any clinician you work for is how receptive they are to your questions. I think that my personal belief is that you want to find somebody who is receptive to your concerns and your research and not dismissive of those. So I often will, encourage my clients, if they've gone to a physician, whether it be back pain or or something with one of their oncologists, if they're turned off by the fact that they ask questions or have done homework and not having the clinician listen to them, that's also important too, because you as the client who's coming in are the most important part of that relationship. And if the clinician is not willing to listen to you, then you're probably not going to build the best plan of care with that practitioner. So make sure that there's somebody who's going to value and seek your input.
Absolutely. And then that wraps it up. So some key points I want you to take away from this. So a cancer diagnosis in and of itself increases your risk of falling. So if you're feeling off balance, it's not just you. A large majority of individuals going through this cancer journey will feel off balance. So we want to get you the right support system. Side effects of treatment can amplify your fall risk, and really a comprehensive assessment is required to identify all those aspects of cancer and treatment that can contribute to your falls. And you want that treatment that you receive to be individualized to account for all of your treatment journey. Okay.
So great, Erin and Mike. Thank you so much. I felt like you had so many good accessible tips for our audience and for those that are going to go and seek the recordings. I know the one, it just struck me, and I saw the steps and the hardwood steps. And I think, like, is there anything that you feel like is a risk with just hardwood steps in general? And maybe there's some kind of workaround to put on those steps, because even
Absolutely.
the visual, right? Like even the visual of the hardwood steps at night, or you just named so many good tips for our audience. That one stood out to me as maybe drawing a little attention to it.
Oh, absolutely. And that's one thing I did glaze over. So thank you for bringing it up. So there are things you can get, like non-skid little strips to put at the edges of those steps. And the other thing I would say is something high contrast. So even if it's just a little piece of tape, so oftentimes those wood steps, they all kind of blend together. And especially in dim lighting, you don't necessarily see the differentiation between each step. So just putting a duct tape down, like the reflective ones, or I've seen people use like leopard print, like anything that makes it look slightly different will be helpful.
Yeah, thank you. And then I saw Erin put in Kinetics in the chat. There was another website you had mentioned for physical therapists to find, but interesting, as I was Googling, you're so right. As soon as you Google, all the physical therapy locations come up in your area, right? So there's a lot you can find. And then with Mike's advice on asking the right questions, you could get to a really good, valuable, resource in your area, credible.
And absolutely ask, you can even ask for a free consultation. Say, would you mind doing a free consultation with me so that I can see what your clinic is like? Like, I want to know more about what you know so that I can feel comfortable in your clinic. And they shouldn't be turned off by that. And they should say, sure, when can we schedule that?
Yeah, that's great advice. I didn't know you could ask for a free consultation.
Oh yeah. You just have to know.
Actually, yeah, I'm like, oh, I didn't know that. Yeah, it's like getting free samples when you go to Whole Foods.
Yeah, exactly.
Can I have some free samples? Wonderful.
Well, if anyone also has any questions for them, we do have just a few minutes left. So we had some questions in the chat. Mike, thanks so much for answering those that have come through. But if anyone has any more questions, feel free to come off of chat or put them or come off of mute or put them in the chat. They're a wealth of knowledge. I was astounded, I will say, by just the statistic of once you fall once, it doubles your risk of falling again. I think that statistic in and of itself is really really astounding.
And then
I'll add
equally,
my email into the chat. If anyone has questions or follow-up
Absolutely.
that they won't think of until after we're off, please feel free to email me. I'm gonna add that into the chat in just a moment.
Yeah, thank you so much for having us. I hope I didn't overwhelm with all that information, but I get excited about this and then I add too much.
No, it was wonderful. And it's really important. Absolutely. And we're glad that we had some of our members working along with you and just doing some of those practical tests that we can do at home. I think a lot of what you were saying, even just the gripping as you move through a room really brings to light some of that, oh, okay, I need to be a little bit more aware. Am I having some issues with balance? Is this something that I need to maybe address and be a little bit more mindful of? So just those really tangible tips are great.
yeah, there was a question about metastatic breast cancer and does the peripheral neuropathy really increase from chemotherapy induced? And sadly, we know it does, like it is ongoing care. That's why, for her, we are committed to staying with you, renewing that passport and staying with you so you have these tools. I think, Erin, you had that stark statistic that you put out there, but equally as valuable was if you did some of these types of exercises or, had these resources. There were really good statistics like Tai Chi that could increase your mobility and decrease your risk. So I thought that was valuable as well.
Absolutely. And even massage to just address the sensation to improve your pain can really improve your ability to walk more steadily. So even those other things, when you're addressing just little pieces of that puzzle that goes into balance, so whether it's just sensation and pain and hypersensitivity in the feet, or it's just weakness, all of those can contribute.
Yeah. I know we have a yoga professional. She's our advisor and she does some work, some yoga work with neuropathy as well, some exercises and movement and, sitting in a chair, moving your feet, sort of in and out. And she has a whole series that she does. That's Michelle Stortz, but I know a lot of yoga professionals will do that. So I think you have to find what works for you because you want to stick with it, right? And I did love the Tai Chi that you brought up because I think that's just so valuable emotionally as well.
Absolutely.
Yeah. Yeah.
Wonderful. Okay. All right. If we don't have any other questions, then we can wrap for the evening. Do we have permission to share your slides with the recording on our library? I think they were really great tools to refer back to. So is it okay if we share your slides?
Oh, absolutely. Yes. And I'm
all-
adding my email as well into the chat.
Wonderful.
Good. I'm
Wonderful.
glad you said yes, Erin, because I already told them that you would. So, kudos.
So whether
Good
I was putting
answer.
it in or not.
No turning back.
Good answer. Yeah.
Good, good, good. Wonderful. Well, we thank you both for joining with us this evening. It's like I was texting with Sue while we were listening, just how smart you are and how much wonderful information you share that I think just goes overlooked. So we are so grateful to have both of you with us this evening and sharing really, really important information. So we're so grateful to you.
We're grateful to be on. So thank you so much. We really appreciate it.
Yeah.
Yeah, thank you all. Thank you all for being here, and Erin, Sue, thank you guys for having us.
Of course.
Got it. Yeah, the presentation, I thought the simplicity of that presentation was so good, Dr. Helm. So I feel like that will be a really valuable one for people to click through and really get to the points that can give them tangible access and resources as well. So really appreciate the way you put that together for us tonight.
Absolutely. Thank you so much.
Yeah. All right, Erin, should you end our series for us today?
Yeah, wonderful. So first, I want to give a thanks again to our digital education sponsors. So West Pharmaceutical for being our presenting sponsor, as well as additional support from Daiichi Sankyo, Lilly, Merck, and GSK. Of course, we're so grateful to them for allowing us to bring amazing experts like who we had this evening each month. And we heard a lot about that chemotherapy-induced peripheral neuropathy. So we'll be addressing that topic again to round out August for our Ask the Experts next Thursday, August 24th. Again, streaming live on Facebook, 1 p.m. Eastern time. And we will be answering those common questions about CIPN. Feel free to submit your questions ahead of time if there's something in particular, uniteforher.org/ask. So hopefully you'll be able to join us, but just like this series, that recording will also be on our Her Library. So uniteforher.org/her library. Tonight's recording will be on as early as tomorrow morning. So be sure to share the link with those that you think can benefit. I think so many people can benefit, even those without a cancer diagnosis. That risk of fall is real. So be sure to come back and rewatch and share for sure. Renee, I see your hand up.
Yeah.
Is it possible to participate if you don't have a Facebook account? How do you participate if you're not with Facebook?
I wonder, we can ask Renee. I am going to check with our digital team if you need an account or if it will be something that's open to the public, in which case then we can get you that link and you can just join as a public member.
I feel like you can, Erin, but we'll check and we'll email you, Renee.
Yep, absolutely. And if there's something in particular you would like to know, Renee, let me know and I'll make sure that we cover it.
Yeah. At the very least, you can always go back and see the recording right after. Rachel, the team is so quick at getting it up on our library. So at the very least, if you're not live and you can see the questions, you can go back and see the recording. Yeah.
Thank you.
Yeah.
Great.
Thank you.